Hey, Dr. Derek Nilsson here, the owner of Kaizen Physical Therapy. I want to talk about a herniated disc. Let's first start off by defining what a herniated disc is. All the yellow that you see here is the nervous system, so all the nerves that run throughout the body, which is pretty amazing just to look at by itself individually. So if we isolate an intervertebral disc, intervertebral is the same as saying a disc in the spine. Vertebrae are, this is one vertebrae, another vertebrae. So intervertebral just means in between the vertebrae. And here we have the disc, which is made up of a firm outside portion, and there's going to be a nucleus pulposus, which is on the inside, which is more of a kind of a jelly. It's been compared to like a jelly-filled donut, where the jelly's on the inside of the donut and the outer portion's a little bit more firm. That is kind of the consistency of a disc as well. When it herniates, when a disc herniates, it essentially means that the jelly within the disc pushes outside of the disc itself. So typically when it pushes out, when it herniates, the fluid is going to come outside, out the back portion of the disc right in here. And this is where the nerves come out of the spine and go down into the limbs. So it can be either, for the neck, it's going to be go into the arms. In the lower back, it's going to be go into the legs. So why a herniated disc can cause symptoms is that if it presses on that nerve, and if we go back here, if it presses on this nerve that comes outside and runs down the leg. So for instance, a lot of people will be told that their sciatica or sciatic nerve, which is this nerve right here, is being inflamed due to a herniated disc. And that nerve comes out of the lower spine, which is right through here. So again, if the disc herniates, and you can see right here, if the disc herniates, then it can push, there we go, it can push on this nerve. So you can imagine that a disc in here, if some fluid gets pushed out the back side, which this is the back of the spine, this is the front, so your stomach versus your back. You can imagine if the disc it herniates and the fluid gets pushed outside of the back of the spine, it can press on this nerve. And that can cause symptoms, again, either down the leg or into the arm. Typically those symptoms are going to be tingling, numbness, or burning, or pins and needles. If it's severe enough, you'll have symptoms of weakness. If you are experiencing symptoms of weakness, I do recommend you go to a medical professional immediately, because that can be signs of some irreversible damage that needs to be addressed sooner than later. So many people will be told that they have a herniated disc, but if they don't have tingling, numbness, burning, pins and needles, or weakness, then it's a little less likely that the herniated disc is actually causing the pain. So the thing you want to remember from this is that a herniated disc doesn't always cause symptoms. It doesn't always cause pain. If we take a look at this image, you see here, the one I want to draw attention to is right here. And it's 36% people shown in this study had a disc protrusion. Now, the medical system classifies the severity of a herniated disc, and a disc protrusion is going to be the most severe, or what you could also say the worst classification. So, but the thing you want to note here is that 36% of people in this study out of 3,110 people had a disc protrusion in their lower back, but yet none of them had any pain. They had no symptoms. And if you look up in the neck, 87.6% of 1,200 people showed a disc bulge in their neck, but yet none of these people had any pain. So just because you have symptoms that are mimic the symptoms that you would feel with a herniated disc, being tingling, numbness, burning, pins and needles down the arm or into the leg doesn't always mean it's going to be due to a herniated disc. There's many other problems that mimic the symptoms of a herniated disc. And just because somebody shows a herniated disc doesn't always mean, well, let me rephrase that. Just because somebody shows they have a herniated disc and they have some symptoms that are typical with a herniated disc doesn't always mean that the herniated disc is the cause of pain. Because if we look at the literature and the studies, they show that people with no pain have herniated discs. So there is a likelihood that you have, or that somebody has a herniated disc and they have tingling, numbness, or burning into the arm or into the leg, but it's caused from something else, which is something that I see quite a bit in my clinic. And some things that we want to take a look at to make sure that they're not causing the symptoms. So first, let's go into the arm. So if you have tingling, numbness, or burning into the arm, then we need to take a look at how does your neck move? Because a lot of times what I see is people who have tingling, numbness, or burning into their arm, and it doesn't have to be all the way down into the hand, it could be anywhere within the arm, is they also have troubles with looking back or looking up, and they'll also be limited in the same direction as the symptomatic side. For example, if I have symptoms into my left hand and I rotate my head to my left, typically what we're going to find is that rotation to that direction is more limited than rotation to the opposite side. And then we're also going to typically find that looking up is a little bit more limited when somebody has symptoms into the arm. Another thing you want to rule out is in the arm, the rotator cuff can refer pain or refer symptoms down into the shoulder or down into the hand or anywhere within the arm. Now, referred pain is a phenomenon that occurs. It essentially means that the area you feel pain is not where the root cause of the pain is coming from. And this is one of the things that I find a lot or see a lot in the clinic, is that people will have tingling, numbness, burning, pins and needles down into the arm, but it's coming from the rotator cuff. And there's 4 muscles that make up the rotator cuff. There's the supraspinatus, infraspinatus, subscapularis, and the teres minor. The infraspinatus is going to be the most likely cause, at least from my experience, that's going to cause these symptoms. Now, we rule this out by lightly pressing on the muscle, one of the rotator cuff muscles, and what will happen is the patient or client starts to feel symptoms down into the arm. That's a positive sign, and that's telling us that you're getting symptoms due to referred pain from the rotator cuff. Another thing that I find that can mimic symptoms of a herniated disc into the arm is called nerve tension testing. So you've got 3 main nerves that go down into each side of the arm. There's the median nerve, the ulnar nerve, and the radial nerve. And what we can do is place these nerves on stretch. And what will happen if it's a positive sign, meaning that we need to work on this, is you will feel, as we place this nerve on stretch, you will feel symptoms of tightness or pain or discomfort, and possibly even nerve symptoms, the tingling, numbness, or burning. So we need to rule out, even if somebody's diagnosed with a herniated disc, we need to rule out a possibility of something else causing the symptoms. Before we just assume, hey, the herniated disc is the cause, we need to at least rule out, let's look at neck movement. Let's make sure the rotator cuff isn't referring pain into the arm. And then let's also do some nerve tension testing and rule that out. Because, again, many times people will be told that the herniated disc is the cause of their pain, when in actuality it's something else. Now, if you're having sciatica or tingling, numbness, burning down into the hip, it's similar in the fact that we want to look at the spine. And a lot of times what I find is people with symptoms, tingling, numbness, burning down into the leg, they'll be limited in spinal extension, which is bending backwards. And just like the neck, they'll be limited in rotation to the same side of where the pain is occurring. We also need to rule out referred symptoms. Just like the shoulder, the rotator cuff can refer down into the arm. Well, the hip, the glutes, and the piriformis can refer symptoms down into the leg. So we need to rule that out, and then we also want to rule out nerve tension testing down into the leg. There's the tibial nerve. Well, the sciatica nerve breaks off into a tibial component and a peroneal component as well. We can test those two nerves to see if they're possibly causing some of the symptoms that someone is feeling. So I hope that this was helpful. The thing that I really want to help people with is I want to save you from unnecessary surgery. And I find that a lot of times people will be diagnosed with something that seems really scary, like a herniated disc, when in actuality, the herniated disc was there before the pain ever started, and your symptoms are coming from something that needs a different approach, meaning something way less invasive than surgery. And we can get you back to 100% with just physical therapy. So if you have a herniated disc, you want to avoid surgery, pain meds, and injections, and you're looking for some help, go ahead and click the button at the bottom of this page to schedule a phone consultation with the clinic. And we want to ask you some more questions about your symptoms to make sure that we sound like the best fit for your problem.